Okay, folks. Today we will learn CPT 2026 updates with images. Mostly today's session will be useful for the outpatient coders as well as people who are planning to write CPC certification exam. Importantly, in today's session we will learn IVR coding as well as prostate biopsy coding, which are major changes we need to follow from January 1st, 2026. So the agenda will be CPT code set changes overview. So basically we will see how many additions, how many revisions as well as how many deletions. As well as we will see summary of changes and we will see evaluation management coding as well as we will see summary of surgery coding changes using the images, radiology, pathology and laboratory code changes, medicine section, category 2 code changes, category 3 code changes, and at last we will have summary and also you are going to see reference for this session. Basically, in 2026, we have 418 editorial changes, which includes 288 additions, 46 revisions, and 84 deletions. From the surgery point of view, major additions and changes in the IVR coding as well as prostate biopsy coding. Don't worry, we will see all those things soon. So here is the summary of changes. Evaluation management, we have 2 additions and no deletions and revised 4 codes. So total we have 173 codes in evaluation management. In anesthesia, there are no changes. In anesthesia, we have 276 codes. In surgery, we have additions 77, deletions 24 and revised 12 codes. Combining all these, currently CPT book is having 5933 codes related to surgery section. Next we have radiology. So here radiology we have 8 additions, 9 deletions and 3 revisions. In radiology we have 662 codes in the CPT code book. Whereas in pathology and laboratory we have 7 additions, 0 deletions, revisions 2. So using these changes, we have total 1667 pathology and laboratory procedure codes. If you see medicine services and procedures, we have 37 additions, deleted 17 codes, revised 18 codes, totals 1091. In category 2 codes, we have no changes. So without changes, we have 565 codes. Category 3 codes, we have 78 additions, deletions 21 and revised 4 codes, counts 607 codes. Next, we have PLA codes, addition 79, deletions 13, revised 3 codes. So total counts to 537. And we have no changes in MA and totals 14 codes. So if we see in 2026, additions totals to 288, deletions 84 and revisions 46. Including these changes in CPT book, total we have 11,525 codes. So if you observe here, year by year, we are going to have more CPT codes due to technical changes. In 2024, we have 11,163, 25, 11,321. In 26, we have 11,525. So year by year, codes are increasing because of technological changes. So first we will see evaluation management. So addition of 2 CPT codes to the system. So there are no deletions and 4 revised codes. Mostly in evaluation management, we have codes related to remote physiologic monitoring just got smarter. So making a continued shift towards digital health and patient-centered care. So basically, as all of us know, most of the patients looking for remote treatment to their conditions. Because of that reason, we have few revisions to remote physiological monitoring. So this includes like blood pressure, blood sugar checking and other type of non-invasive checkings. Here we have CPT code 99453 which is revised. So old description is remote monitoring of physiological parameters like weight, blood pressure, pulse oximetry, respiratory flow rate, initial setup and patient education and use of equipment. Okay, so this is 2026 description. So basically here we have same description with the additional instructions. So if you see in the CPT book, you will see this description. So do not report 99453 for cumulative monitoring of less than 2 days in a 2-day global period or 30-day period. So they are telling that if the monitoring is less than 2 days in a 30-day period, we can't use 99453, which is a instruction in the CPT code book. Next 99445 is the new code here. So as it is a new code, we don't have any old description. And if you see in the 2026 update, which is for devices supply with daily recording or programmed alert transmission 2 to 15 days in a 30-day period. So basically this code is for daily recordings and program alerts. Next we have 99454 which is revised code. So remote monitoring of physiological parameters, weight, blood pressure, pulse oximetry, respiratory flow rate. So basically these all are monitored by the physician using the remote monitoring. Initial device supply with daily recordings or programmed alerts. Transmission each 30 days. So if you see same code in the 2026, so device supply with daily recordings or programmed alert transmission 16 to 30 days in a 30-day period. So 99445 is 2 to 15 days in a 30-day period. Okay. 99454 is 16 to 30 days in a 30-day period. So that is the difference. So here we will code physiological monitoring using the days in a 30-day period. So if it is 2 to 15 days, 99445. If it is 16 to 30 days, 9944, 99454. Now we have 99470 which is a new code and we don't have any description in 2025 and 2026 new update. RPM treatment management services, clinical staff, physician or other QHP, time in a calendar month requiring one real-time interactive communication with the patient or caregiver during the calendar month first to 10 minutes. So if the patient performs 10 minutes of RPM, we need to use 99470. So 99457 is revised. So if the patient performs RPM of first 20 minutes, we need to use 99457. If the patient performs each additional 20 minutes after first 20 minutes, we need to use 99458 as it is a add-on code. So for example, if the patient performs RPM of 45 minutes, how do we code? So we need to code 99457 as well as 99458 twice. Why means it is each additional 20 minutes. So in our question we have 45 minutes, correct? For first 20 minutes we will use 99457. So remaining 25 minutes 120 we will use 99458 and remaining 5 minutes we will use 99458 again as code description is having each additional 20 minutes. So basically we no need to worry here. So these are the remote physiological monitoring devices. Okay. So you don't need to worry. In 2026 CPT book, we are going to have all these table related to RPM. So 0 to 9 minutes we will not code or we will not report separately. 10 to 19 minutes we need to use 99470 times 1. So 20 to 39 minutes 99457 times 1. 40 to 49 minutes 99457 into 1 and 9945 into 1 or times 1. And 60 minutes or more we need to use 99457 into 1 as well as 9945 into 2 or more for each additional 20 minutes. Precisely for 99470 we need 10 minutes, minimum 10 minutes. For 99457 we need minimum 20 minutes. So now these are the very important changes we need to learn. So in the surgery section we have integumentary section No additions, no deletions, only one revision. In the musculoskeletal system, we have 2 additions, 2 deletions and 2 revisions. In the respiratory and cardiovascular system, we have 48 additions, 20 deletions and 4 revisions. In digestive, we have 2 additions and no deletions and no revisions. In genitourinary, we have 14 additions, 2 deletions and 2 revisions. Nervous, eye and auditory, we have 11 additions, no deletions and 3 revisions. So it totals in 2026 we have 77 new codes, 24 deletions as well as 12 revisions. So mostly we have changes in cardiovascular system as well as in genitourinary system. So here these codes are due to changes in the IVR coding of lower extremities. In genitourinary system, these changes are due to change in the prostate biopsy coding. So we will see all those codes using the images now. So in integumentary section, there are no additions, deletions, revision. So one code description is revised. Okay. So what is that? One revised code. For 2026 CPT code, 10,040 has been updated to remove the term acne surgery from its description. Okay. So previously in 10,040 we have acne surgery and in the bracket we have marsupialization, opening or removal of multiple milia, comedone, cyst, pustule. But in 2026 you will not see acne surgery. Instead of acne surgery they have changed it to extraction. Okay. So now latest or new code is extraction. Example marsupialization, opening or removal of multiple milia, comedone, cyst and pustule. Okay. So basically the purpose of the change is to this code we can use for these all conditions like milia, comedone, cyst and pustule. So this code is not only for acne surgery. So that's why they have changed this code description. So now you can use 10,040 for all small skin lesions. So not only for acne surgery. In musculoskeletal system, we have 2 additions, 2 deletions and 2 revisions. So here we have 2 new codes, 27458 and 27713. So what is 27458? So femur osteotomy with externally controlled intramedullary lengthening device. Okay. And 27713 tibia including fibula osteotomy with externally controlled intramedullary lengthening device. So basically physician will perform this limb lengthening procedure for congenital deformities in the length of the femur and tibia. This is the externally controlled intramedullary lengthening device. So this is the externally controlled device. So here physician will place the intramedullary rod. So here is the and he will apply this externally controlled device in order to regulate the height of the femur. Okay. So this is the use of this code 27458. So externally controlled. So physician here not touching anything into the body. So externally controlled limb lengthening device. So this is the externally controlled limb lengthening device. So 27458 is femur osteotomy. So 27713 is for tibia including fibula. So if the documentation contains only femur osteotomy, 27458. If the documentation contains both tibia and fibula, we need to use 27713. So here intramedullary means inside the medullary cavity. So this is the medullary cavity. Inside the bone we have the medullary cavity. So this device will adjust the height of the length, bone length. Just in this course, physician will perform the osteotomy first based on the location. Next we have 2 revisions in musculoskeletal system. Arthrodesis, sacroiliac joint. Okay. 27278. Arthrodesis, sacroiliac joint, percutaneous or minimally invasive with image guidance, includes obtaining bone graft when performed. Unilateral placement of intraarticular device without cortical piercing. Okay, so basically this is very extensive procedure and this code includes all major constituents of sacroiliac joint arthrodesis 27278. So which includes percutaneous or minimally invasive with image guidance is included. Obtaining bone graft is included if it is performed, and it is unilateral if the patient performs both sides. You need to use 50 modifier, and placement of intra-articular device without cortical piercing means physician will place the device in the joint or sacroiliac joint. That's why they have mentioned intra-articular. So next 27279, placement of transarticular device and intra-articular devices piercing the lateral medial cortex of the ilium and the lateral cortex of the sacrum. So basically 27278 is without cortical piercing, 27279 is with cortical piercing. So what do we need to remember here? From January 1st, 2026, do not report 27278 and 27279 for the same joint. Why means? So 78 is without cortical piercing, 279 is with cortical piercing. So we can't code both codes at the same time. Use modifier 50 when the procedure is performed bilaterally, as code dictionary itself is having defaulty 27278 is unilateral procedure. The physician performs bilaterally, we need to append 50 modifier. Okay. Hybrid procedures are reported with 27279 when any device pierces the cortices. Okay. When the documentation contains hybrid procedures, we need to use 27279, where in the documentation we need to check whether piercing is included or not. So basically they are telling about this fusion. Okay, so intra-articular. So this is the sacroiliac joint. Here there is a break. So they will percutaneously they have placed an screw here. And we have two deletions in musculoskeletal system. As most of the patients are not performing this procedure, they have deleted these two codes 27445 arthroplasty knee hinge processes and 27468 osteoplasty femur combined lengthening and shortening with femoral segment transfer, as these procedures are not used by the physician regularly. So that's why they have removed this one. Now we will see respiratory system. So in respiratory system there are no additions, no deletions and no revisions. Good, correct? And also if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And if anyone looking for same-day surgery coding training, IPDRG coding training, SCC coding training, CCS certification training, please contact 707-526-3939. Now we will see cardiovascular system, where we have huge number of additions like 48 and deletions 20, revisions 4. So most of the changes are in the lower extremity revascularization, and also along with we have changes related to TEVAR. So endovascular repair of the thoracic aorta. The 2026 CPT code set introduced major revisions to thoracic endovascular aortic repair. Okay. Coding within the surgery cardiovascular system. These updates modernize how procedures are reported by shifting focus from general procedure intent to anatomy based code selection. So we will see the images. So these are the TEVAR procedure, and here we have two new codes for TEVAR procedure. Okay. Deleted code, 7 existing codes for TEVAR will be deleted. 4 from radiology section. Revised, 4 existing TEVAR codes will be revised, and updated guidelines related to TEVAR with thoracic branch endograft procedures, and which will have a new header and revised guidelines. So first we have thoracic branched endografts, TBE. So these are two new codes. So 33882 and 35602. So what is 33882? Endovascular repair of the thoracic aorta using a branched or fenestrated multi-piece endograft system involving an aorto-aortic tube device with fenestration for the left subclavian artery. Okay. So this is the endovascular repair, and this is the thoracic aorta, and here physician will insert multi-piece endograft system. So this is the multi-piece endograft system where the tube will be penetration into the left subclavian artery. So this is the left subclavian artery. Okay. So if you want to code this 33882, you need to follow these instructions. Deployment of a multi-piece system with a penetration for the left subclavian artery. So you need to check in the documentation whether patient is penetrating into the left subclavian artery or not. Selective catheter placement into the left subclavian artery. All proximal extensions to the level of the left common carotid artery. Okay. And all distal extensions to the level of the celiac artery. So you need to check all this in the documentation. Next we have 35602. Open carotid bypass graft other than vein. Placement prior to TEVAR or TBA. So this is basically open procedure. So here patient will perform carotid to carotid bypass graft. So this is the left carotid artery. This is the right carotid artery. So here there is a graft between left and right carotid arteries. Right common carotid artery and left common carotid artery. Okay. So that time we will use this one. And as we have discussed previously, we have 4 revisions in TEVAR procedures. 33880 thoracic endograft including all distal extension graft. 33881 thoracic endograft including all distal extension graft not covering left subclavian artery. 33883 delayed placement of proximal extension processes. 33886 delayed placement of distal extension processes. So this is the image related to these revised codes. So if you see here there is no subclavian artery penetration. So that time we will use 33881. So thoracic endograft including all distal extension grafts not covering left subclavian artery. So here it is not covering the left subclavian artery. So this is the left subclavian artery. So that time we will use this one 33881. So here we need to note revision 33880 and 33881 includes all proximal and distal extension and anatomical code differentiation. Okay. So 33883 replaces deleted codes 884, 889 and 891. Report once per session regardless of number of modules. So you can use this code only once per session. So next these are the deleted codes. Okay. So 33884, 889, 891. Use 33883 instead of these codes. Okay. For open subclavian to carotid transposition use 35694. For carotid to carotid bypass use 35602. Just now we have seen. Okay. In radiology section these all codes are deleted as these are included in the 30,000 series codes. Now we will see cardiovascular system related to IVR. So lower extremity revascularization procedure. So basically we have 46 new codes here. So basically here previously until now we have 3 vascular territories. Okay. So now 2026 onwards we will have 4 vascular territories. As vascular technologies are advancing, so these changes are proposed from 2026. So there are 46 new codes. 6 new codes replaces the 16 outdated codes. So range to better capture procedural complexity, vessel specific anatomy and modern device use. Okay. So these changes improve coding clarity and support accurate reimbursement for interventions aimed at restoring blood flow to the lower extremities. So most of the time we need to use these codes for occlusions as well as stenosis. Okay. So these are the 4 territories. So aorta, iliac, common femoral and popliteal, femoral and popliteal and posterior and tibial as well as dorsalis pedis and pedal arch. So first we will see 46 new codes. So the new CPT code structure defines 4 distinct vascular territories. Iliac territory consists of common, internal and external iliac arteries. Okay. So femoral and popliteal consists of common femoral, profunda femoris and superficial femoral and popliteal arteries. Tibial and peroneal consists of anterior tibial, posterior tibial, peroneal arteries. So far until 2025 we have only these three territories: iliac, femoral and popliteal, tibial and peroneal. From 2026 onwards, we are going to have inframalleolar, dorsalis pedis and plantar arteries. So this is the dorsalis pedis and plantar arteries. So each territory has primary code for the initial treated vessel. Okay, so all these four territories are having individual initial code for primary procedure. Okay, add-on codes for additional distinct vessels, distinct between straightforward and complex lesions, inclusion of intravascular lithotripsy as new add-on options. So now in the documentation we need to check whether physician is telling stenosis or occlusion. Okay, so stenosis is straightforward and occlusion is more complex. So these are the code ranges: 372542, 37262 iliac territory, 372632, 37279 femoral and popliteal, 372802, 3729 tibial and peroneal, 372962, 37299 inframalleolar. So how do we select the code? So these are defaultly unilateral procedures. Okay. So we need to select the code based on the vascular territory. And also we need to check in the documentation whether lesion is straightforward stenosis or complex occlusion. Okay. And also whenever we want to code, we need to check the documentation for initial or each additional vessel. Okay. And the therapeutic procedures includes angioplasty, atherectomy, stent placement, as well as we have separate set of codes for intravascular lithotripsy as it is a add-on code. So here is the lower extremity revascularization table. So iliac territory consists of common iliac, internal iliac and external iliac. So here we have four interventions: angioplasty, stent, intravascular, lithotripsy. Okay. Codes ranges from 37254 to 37262. Next we have femoral popliteal. So what are the arteries in femoral popliteal? Common femoral plus profunda femoris, one artery. Superficial femoral plus popliteal, one artery. So we will not consider two arteries here. Common femoral plus profunda femoris consists of only one artery. So here also we have angioplasty, less expensive procedure, stent, atherectomy, stent with atherectomy and intravascular lithotripsy. Here we have 372632 to 37279. If you see third vascular territory, tibial peroneal. So here we have three arteries: anterior tibial, posterior tibial and peroneal. Okay. So tibio-peroneal trunk includes or part of the posterior tibial or peroneal unless only vessel treated. Okay. So here whenever documentation contains tibio-peroneal trunk which is included in the posterior tibial or peroneal, so we will not code this tibio-peroneal trunk along with posterior tibial or peroneal. In the documentation usually we will see it as TP trunk. Okay, so TP trunk means tibio-peroneal trunk. Okay, so here also we have few interventions like angioplasty, stent, atherectomy, stent with atherectomy. Okay, here the code ranges from 37280 to 37295. So this is the last one, inframalleolar territory. Here we have two arteries, dorsalis pedis and plantar. So pedal arch is considered part of the dorsalis pedis or plantar unless only vessel treated. Here in inframalleolar we have only angioplasty. We don't have stents or atherectomy. Okay. As these inframalleolar arteries are very minute, we don't have very complicated procedures like stent atherectomy. Okay. Here the code ranges from 37296 to 37299. So whenever we code lower extremity revascularization, first we need to check for the lesions. Okay. So if the documentation contains stenosis, we need to consider it as straightforward. Okay. If the documentation contains occlusion, we need to consider it as complex. So what is vascular territory? Collection of anatomically related arteries considered together for coding purpose. So as we have discussed, we have four vascular territories: iliac territory, femoral popliteal, tibial peroneal as well as inframalleolar. So these are the iliac artery. major arteries supplying blood to the pelvis and lower limbs, including the common iliac artery, external iliac artery, and internal iliac arteries. Okay, so these are the iliac artery territory. And we have femoral popliteal territory or FEMPOP. So region from the upper leg to the knee. So this is the upper leg up till the knee, including the common femoral, profunda femoris, superficial femoral, and popliteal arteries. Okay. Next we have tibial peroneal territory. Okay, region below the knee to the ankle. So from here to this area, including the anterior tibial, posterior tibial, and peroneal arteries. And lastly, we have inframalleolar territory. So region in the foot formed by the distal portions of the tibial and peroneal arteries and their branches include the dorsalis pedis, lateral tarsal, medial plantar, and lateral plantar arteries. Okay, here it is like this. So iliac territory, femoral popliteal, tibial peroneal, and intramalleolar. Okay, so this is the very important thing you need to remember while choosing the course. So straightforward versus complex lesion. Okay, so what are the keywords for straightforward? Stenosis, narrowing of blood vessels, blood passes beyond lesion. Okay, less than 100% blockage, near total or subtotal occlusion. So these all are the keywords for straightforward lesion. So if you want to code for complex lesion, these are the keywords: occlusion, complete blockage of blood vessels, blood does not pass beyond lesion, 100% blockage, and total occlusion. So this is very important if you want to code lower extremity revascularization procedures. So what do we code separately? Extensive repair or replacement of an artery 35226 and 35286. Intravascular ultrasound like 37252 and 37253 as usual we will code separately. Then report separately. Catheter code for diagnostic angiogram through different puncture site. Okay, if the patient performs diagnostic angiogram as well as therapeutic procedure, we will not code diagnostic angiogram. But if the patient uses the different puncture site, we can code this cath codes for angiogram. Okay, so diagnostic angiogram that meet criteria, not reported separately. Cath codes for diagnostic angiography through the same access site, where physician will perform the therapeutic angiogram that do not meet criteria. So what are the modifiers you will use for lower extremity revascularization? So 50 modifier, same vascular territory, same treatment, initial vessel, both sides. Okay. Add-on code, same vascular territory, same treatment, additional vessel. 59 modifier, same vascular territory, same treatment, different vessel. So we will see one example here. An unsuccessful attempted crossing of an occluded 16 cm superficial femoral artery lesion from contralateral axis. So contralateral means opposite side. So report as a diagnostic arteriogram. So 362/7 selective catheter placement arterial system, initial third order or more selective abdominal pelvic lower extremity branch within a vascular family, and we need to code for angiography extremity unilateral. So here physician has performed only what do you call angiography. So we need to code catheter as well as angiography. Okay. So these are the key things you need to remember whenever you call lower extremity artery revascularization. Okay, so you can use these codes for both open as well as percutaneous approach. So we have 4 territories. So stenosis means straightforward, occlusion means complex. We need to check initial and external vessels. We need to check angioplasty. So angioplasty is possible in all 4 territories. Stent placement is in only 3 territories. Inframalleolar, we don't have any stent placements. Atherectomy, not iliacs. We don't have atherectomy in iliacs, in not inframalleolar. Stent with atherectomy, not iliacs, not inframalleolar. Okay, I will for iliac and I will for femplop per vessel, not for tibialis or inframalleolar. So what is IVL here? Intravascular lithotripsy. We will see deleted code. So one code has been deleted, which is 37500 vascular endoscopy surgical with ligation of perforated vein subfacial. So these are the codes for iliac territory. So 372542, 37257 and 37258, 37259. So if you observe these codes, 37254 straightforward lesion. So revascularization, endovascular, open or percutaneous, iliac vascular territory with transluminal angioplasty. So this is related to iliac territory. So this code we can use for angioplasty. Here unilateral straightforward lesion, initial vessel. Okay. If the patient performs angioplasty in the different vessel, you need to use 37255. So straightforward lesion or stenosis, you can use same code 37254. Okay. So 37256 and 257 are for complex lesion, initial vessel as well as each additional vessel. So for example, if the patient is having complex lesions in two vessels, you need to code for first one and physician will perform the angioplasty. For first one 37256. For additional vessel, we need to use 37257. And 37258 is for transluminal stent placement, including angioplasty. If the patient performs both stent as well as angioplasty, straightforward lesion or stenosis, initial vessel 37258, 37259, each additional vessel 37260 for transluminal stent placement, including transluminal angioplasty, perform complex lesion. Okay, 37261 complex lesion, each additional vessel. Okay, 37262 intravascular lithotripsy. And if anyone looking for medical coding jobs in UAE, USA, and India, please join in our WhatsApp group. WhatsApp group link is in the description of this video. And if anyone looking for same-day surgery training, IPDRG training, SCC training, CCS certification training, please contact 707-526-3939. Next, we will see gastrointestinal surgery. So we have two additions, no deletions, no revisions. So 43889, describing endoscopic sleeve gastroplasty. So far we used to use the unlisted code. From 2026 onwards, we have one separate codes for endoscopic sleeve gastroplasty. Most of the time, physician will perform this procedure for morbid obesity, okay, or gastric restrictive procedure. So this is the procedure, endoscopic sleeve gastroplasty. Here, physician will insert the endoscope through the esophagus and into the stomach, and he will perform the shrinking of the stomach using the coagulation. So this is before procedure and this is the after procedure. See here, patient is shrinking the stomach so that patient will take lesser food. So this is the arrows denotes this stomach is shrinked. Okay. Next we have 47384, describing percutaneous ablation of one or more liver tumors using irreversible electroporation. We will see it as IRE. So this is the electrical electroporation, irreversible electroporation. So this is the tumor here. Okay. Physician will transfer the electrical pulses towards the tumor. Okay. So these electroporation cells will destroy this tumor. So this is the technology related to 47384. In genitourinary, we have 14 CPT codes and no 2 deletions and 2 revisions. Most of the time, these CPT codes are increased due to prostate biopsy codes. So there are two new codes in the urinary and male genital system surgery. These new codes include 52443 and 52597. So 52443, cystourethroScopy with initial transurethral anterior prostate commissurotomy with a non-drug coated balloon catheter, followed by therapeutic drug delivery into the prostate by drug coated balloon catheter, including translux ultrasound and fluoroscopy when performed. Okay. So here this technique consists of patient will perform both procedure same time, mechanical dilation as well as localized drug delivery after performing the dilation. So this is the procedure. Okay, so patient will insert the endoscope here and he will dilate and he will provide the drug to the prostate tissue. Okay, so this is endoscope insertion, this is balloon dilation as well as drug distribution here. Next we have 52597. So far transurethral robotic assisted water jet resection of prostate. So far we are using unlisted code 0421T. So 2026 onwards we need to use 52597. Okay. In male genital system, we have only one deleted code which is 55700 biopsy prostate needle or punch singular multiple any approach. So basically, so this is the punch biopsy they have deleted 55700. So basically this is a open procedure. So instead of this one, they have replaced 55700 with 9 image guided biopsy codes. Okay, and these imaging guidance include ultrasound, MRI fusion or in-bore CT MRI. So we have one revision related to prostate biopsy 55705 biopsy prostate any approach non-imaging guided. So if the documentation does not contains any type of non-imaging or without imaging 55705. So next we have new codes here, 9 new codes. Okay, ultrasound guidance sextant. So basically here sextant means taking biopsy of the prostate left side 3 and right side 3 locations, top, middle and bottom, left side and top, middle and bottom on the right side. So transrectal guidance 55707, transperineal 55709. So here physician will use only ultrasound guided. Ultrasound guided with MRI fusion guidance 55708 and 55710. Another set of codes are MRI ultrasound fusion guided targeted lesion only 55711, 55712. So here physician will use the targeted lesion, not sextant. Okay. Next, here these codes are based on translectal or transperineal. So in-bore CT or MRI guided sextant. Okay. So in-bore CT means so patient will be inside the CT machine and patient will take the biopsy of the prostate like as it is a sextant. You will get left side 3 samples, right side 3 samples or 3 locations. Here transrectal 55713, transperineal 55714. And we have one more code 55715 biopsy prostate each additional MRI, ultrasound fusion or in-bore CT or MRI guided targeted lesion. So let's separately in addition to code for primary procedure. So along with this primary procedure we need to use this one. So the main intention of creating these codes is appropriate approach, appropriate imaging technique as well as targeted lesions. So these are the guidelines related to these 9 new codes. So these are the 6 areas. So right base, right mid, right apex, left base, left mid and left apex. Next we have one revision here 55866 laparoscopy surgical prostatectomy retropubic radical including nerve sparing includes robotic assistance when performed. So just they have revised to introduce related add-on options. So this is the water jet ablation. See this is the prostate. Patient will insert the probe here and he will perform the water jet. So this water jet rotates and it will like remove the prostate tissue. So these are the prostate biopsy code 55707, 55708, 55711. So these are the transrectal approach. Okay. 709, 710, 712 transperineal approach. 713, 74, 715 in-bore. Okay. So whenever you want to code prostate biopsy, first we need to check without imaging guidance or with guidance. So without imaging guidance, we have one code 55705, one code. With imaging guidance, we have 55706 55715, 10 codes. And we need to check the modality, whether it is ultrasound, ultrasound with MRI, ultrasound fusion or CT or MRI guided. Next, we need to check the biopsy. So if it is sextant, 6 areas targeted from discrete lesions included in sextant biopsy if performed. In-bore performed in a scanner. And in male genital system, we have 3 new codes 55868, 55867. These are for lymph node biopsy. Okay, so laparoscopy, surgical prostatectomy with lymph node biopsies, limited pelvic lymphadenectomy. 55868. If the patient performs bilateral pelvic lymphadenectomy along with surgical prostatectomy, laparoscopic, including external iliac, hypogastric, and obturator nodes, 55869. And we have one more new codes, 55877, ablation and focal therapy codes. Ablation, irreversible electroporation, prostate, one or more tumors, including imaging guidance, percutaneous. And we have one new code from category 3 code 0950T, ablation of benign prostatic tissue transrectal with high intensity focused ultrasound HIFE, including ultrasound guidance. Okay, so patient will use this code for BPH, or we need to use this code for BPH, benign prostatic hypertrophy. So nervous eye and auditory system, we have 11 additions, no deletions, 3 revisions. So CPT code set introduce important updates in nervous system section to better capture advancement in minimally invasive spinal and peripheral nerve. Procedures include more certain procedures for category 3 to category 1 status. Add a new code for annular defect repair, and we have percutaneous option for carpal tunnel decompression. So we have 11 new codes here. Percutaneous decompression of neural element 62330 and 60331. Okay, so these are the new codes. 330 percutaneous decompression with partial removal of ligamentum flavum, including laminotomy for access, epiduorography, and imaging guidance. Bilateral 1 interspace lumbar. 62331 each additional lumbar interspace. So basically this is for percutaneous decompression of the lumbar spine. Okay. Here we will use 52 modifier if the patient performs same procedure on unilateral. Why means default is 62330 is bilateral. If the patient performs only one side, 52 modifier. Do not report 62331 more than once per operative session. Okay, we can't use 62331 more than once. Next, we have new codes for posterior extradural laminotomy or laminectomy. Okay, here we have new add-on code has been introduced to describe repair of lumbar spinal disc annular defect using the bone anchored closure device. This addition complements existing lumbar decompression codes. 63032. Repair of annular defect by implantation of bone anchored closure device, including imaging guidance, 1 interspace lumbar. So basically this is annular defect is annulus pulposus. Okay. Related primary code is 63030. So we need to use this one along with 63030. Here primary is 63030 and secondary is 63032 if the patient performs annular defect repair. Okay, next we have reporting cranial nerve field stimulation technique. We have 64767. Percutaneous electrical nerve field stimulation cranial nerves without implantation. So next we have 11 new codes, autonomic nervous system modulation. Okay, so usually we will call it as baroflex activation therapy or BAT modulation system. Okay, 64654 initial open implantation of complex device, revision or replacement and lead. Complete device consists of pulse generator and lead. If the patient performs the revision or replacement, lead only 64655. 64656 revision or replacement of BAT pulse generator only. 657 removal of total BAT system. 658 removal of BAT lead only. 659 removal of BAT pulse generator only. So most of the time patient will perform this procedure for any type of heart related conditions. And next we have neuroplasty nerve decompression 64728 for carpal tunnel syndrome. This is a percutaneous decompression procedure 64728. Next we have radiology, 8 CPT additions, 9 deletions, 3 revisions. Okay. So these are self-explanatory. So we can read as much as possible. So these are the new codes, 8 new codes, 70571, 472, 473, so 75577 and 77436, 77437, 438, 439. These are for surface radiation therapy. Next we have 3 revised codes, 77402 radiation treatment delivery intermediate as well as complex, deleted in 2026. So these all codes are deleted. Okay. So instead of this one, we need to use 77387. So in pathology and laboratory, 7 CPT codes added, no deletions, 2 revisions. So here, significant research across pathology and laboratory. So here, 7 new codes, 354, 52, 81354, these all are 7 new codes. Here 2 revised codes, 83015, heavy metal screening, 83018, qualitative, quantitative, each not elsewhere classified. In proprietary laboratory analysis, 79 CPT codes added, 13 deletions, 3 revised. So PLA code, so these all are PLA codes, 0521U2, 0599U. Revised 0095U, 0285U and 0365U. These 13 are deleted. So in medicine section, we have 37 CPT codes are added, 17 deletions and 18 revisions. So these are the talk side. They have added 11 codes they have added. And they have revised 2 codes. And they have deleted 2 codes and they added 2 codes. So rectal sensation tone and compliance study. And ophthalmoscopy, they have revised and new code. So this is new code, green one 92284 and 92288, revised code. And otolaryngology hearing device, these are the changes. Hearing devices services deletion. So these all codes are deleted. So hearing device services, 12 new codes are added. So 6 deleted, 12 added. 966282, 96635 and 92636 and 92642. Cardiology, interventional cardiology, coronary therapeutic procedures, PCI. Okay. So revised 10 codes. So these are the revised codes. Exclusively for PCI, percutaneous coronary interventions. Mechanical scalp cooling services, 3 new codes in the medicine section. Remote therapeutic monitoring services, these codes. And 3 new codes for respiratory REM device supply, musculoskeletal and cognitive behavioral therapy. So revised RTM codes, new 16 to 30 day reporting windows. So 989, 976, 977, 978. Already we have seen. New treatment for magnetic management code 98979. First 10 minutes, first 20 minutes and each additional 20 minutes. In category 3 codes, we have 78 CPT codes added, 21 deletions and 4 revisions. So these all are deleted codes, 21. Here we have revised codes. Next, these are the new codes. So if you want, you can check all these codes. So thank you team. So thanks for watching this video. If you have any concerns, please mention in the comment section of this video.